Hello, my name is Dr. Jonathan Becker, and I'm the Medical Director of the Neuroscience and TMS Treatment Center in Brentwood, Tennessee, right outside of Nashville. I'm also a member of the Clinical TMS Society and serve on the Education Committee. And I'm making this video in part to educate patients and family members of potential patients about TMS. And so what I'd like to do is start by telling you what TMS is. TMS is a brain stimulation technique that's used to treat predominantly major depressive disorder. It is also approved for obsessive compulsive disorder, smoking cessation, and migraines, but the real predominant use of it is for major depressive disorder. What it is, it's a brain stimulation technique, TMS. It stands for Transcranial Magnetic Stimulation. But what it actually does is it uses some properties of magnetism in physics that uses a magnet and a coil to generate a focalized electrical field that actually stimulates a small part of your brain that's underactive in depression to make it more normally active. That part of the brain then sends connections to deeper part of the brains that helps to restore normal activity of brain regions that are not functioning correctly in depression. It is a very safe technique. It is a very effective technique. Really the only side effect people experience for the most part is a headache during the procedure. It can be a little intense at first. Feels like a woodpecker tapping at your head. But after about a week or so, people tend to get used to that and they don't even really notice it anymore. And they'll come in and even, fall asleep in sessions. There is a very, very rare but serious risk. This is one of those one in hundreds of thousands of situations where we are stimulating your brain. If that were to generalize, you could potentially have a seizure. There are some risk factors we look for that, so a history of seizures, alcohol use, and sleep deprivation, so sleeping less than 4 hours a night, are some risk factors we'll screen for when considering whether somebody is a candidate for TMS. In terms of who is a potential candidate, so TMS is used to treat treatment-resistant major depressive disorder. And so its technical FDA approval is for after failure of one antidepressant trial. Oftentimes, though, insurance and clinically, people are going to have failed at least two medications before we consider TMS. And the reason we look at two medications is that we know from studies that have been done that after you fail two medications, your chance of responding to a third, fourth, fifth medication actually drops pretty dramatically. And doing something with a different approach like TMS is much more likely to get someone's depression in remission than just continuing to cycle through more and more medications. And so that those are the folks that are typically going to come for TMS. The vast majority of people will get significant improvement, if not complete remission of their depressive symptoms with TMS. And like I said, from a side effect standpoint, it's a really good option because it is so well tolerated and there's so few side effects, especially once you're comparing it to some of those third, fourth, fifth line antidepressant trials or atypical antipsychotic augmentation and those sorts of things. So if TMS is something you're interested in or think you may be a candidate for, I certainly encourage you to investigate it a little bit further. You can use our website for the Clinical TMS Society is a resource to help find a provider in your area or just find out some more information. Thanks for watching my video.